Thank you for listening to Depictions Media Radio.
Legal and budgetary steps needed to secure their participation in this innovative global partnerships. For example, we are actively collaborating with financial institutions like the Inter-American Development Bank to support countries in our region access the funding needed to purchase vaccines through the COVAX facility when they are available. PAHO is also collaborating with the Caribbean Public Health Agency, CAFA, and the European Union to provide financial support for the down payment required by the COVAX facility for Caribbean countries to join. 11 countries will be covered by this agreement. This will help to ensure that the Caribbean people, especially the most vulnerable, can benefit from a safe, effective COVID-19 vaccine. And finally, PAHO's revolving fund, with more than 40 years of experience providing affordable and quality vaccines to countries in Latin America and the Caribbean, will be, along with UNICEF, the purchase mechanism for the COVAX facility. Our region is hard at work preparing for our vaccine, but we must also keep a strong and steady course to continue fighting the virus without a vaccine. Treatment options, unfortunately, remain limited. This means that we must continue to rely on the best strategies available to us: effective surveillance and sound public health measures. Testing, treating, and isolating cases, as well as tracing contacts, are all part of a good surveillance strategy. And really too few countries are doing this well in our region. I want also to call on all persons to continue practicing the public health measures which have proven to be effective. Wash hands frequently, wear a mask, observe social distancing, and avoid congregating. I urge all member states to prioritize a transparent and proactive communications approach for COVID-19. The people of our region crave clear guidance. Communicating effectively and consistently about what they can do to protect themselves and to avoid infection remains vital. It's as important now as it was in April, and it will be even more important once we have a vaccine. Together, we can overcome COVID-19.
Muchas gracias, doctora Etienne. Vamos a comenzar ahora con las preguntas que ya hemos recibido por correo electrónico y luego pasaremos a las preguntas del chat. Recuerden que pueden hacernos sus preguntas a través del QIA y les pedimos incluir su nombre y el medio de comunicación. La primera pregunta nos llegó de Daniel Collins de TN23 en Guatemala. Dice: ante el escenario que se está viviendo en Europa por la ola de contagios por COVID-19, ¿los países deberían evaluar un posible cierre o nuevas restricciones para evitar un impacto mayor de contagios? Doctora Etienne.
So, thank you for this question. As I mentioned a bit earlier, while an average of some 100,000 people continue to test positive for COVID-19 every day in the Americas. Yes, it is a tremendous number. Over the past week, however, our region has been overtaken by a resurgence in Europe following the relaxation of public health measures such as physical distancing and non-essential travel during the summer. However, there are a couple of points to keep in mind when looking at second waves of COVID-19 transmission occurring in other parts of the world and trying to predict what will happen here. The first is that COVID-19 transmission remains high in our region, which has different dynamics to those of Europe. For example, in addition to the high rates reported in the United States of America and Brazil, as of today, 4 of our countries, Argentina, Colombia, Peru, and Mexico, have reported between 850,000 to 1 million cases. The Americas has huge economic and social disparities, more so than any other region. And this has certainly impacted countries' abilities to ensure adherence to the recommended public health measures. So to say that we are already over a first wave and to start looking towards a potential second wave may well be premature. The region is still very much dealing with a significant outbreak. Having said that, we can certainly look to other regions to see emerging patterns as well as the consequences of similar challenges that we face in our region, including COVID fatigue, social inequalities, and economic pressure. And this is why it is so important that countries of the Americas continue to implement the recommended flexible, data-driven public health measures in the areas where community transmission is rife, and to ensure that these are accompanied by the necessary social and economic support. Only by taking these steps will we continue to flatten the curve, keep the virus at bay, protect our health services, and ensure that the most vulnerable in our communities are not left behind, while the vital work of vaccine development continues. Thanks.
Gracias, doctora Etienne. La siguiente pregunta.
Thank you, Dr. Etienne. The next question is by Paulina Alcázar from Cancun News. She says that they have noticed that the fatigue as a result of the pandemic and also the wish to go on vacation has been intensified among those individuals who already had COVID, and this also has an impact on those that were not infected and that dare go out with the same intensity. Does this create a false sense of security and also the information about transmission? And how can we communicate this to the population when we have exhausted all the resources? Thank you very much, Paulina. This is a very important question. Yes, she is right. This could lead to some feeling of false certainty or security when we lower our guard, but we do not think that all of the means have been exhausted. And that's the reason why it is important to be innovative. Educational programs that need to be sustained for the education and the preparation of the communities so that they continue with the non-pharmaceutical measures and to avoid large groups of individuals, and also to wear a mask whenever they go outside, whenever we go out to the pharmacy or to the supermarket. Vacations may also be a possibility, but always maintaining those measures as far as possible. Because we see what is going on in Europe with the second peak, with the second surge. So it is important to involve the community. The community leaders are key. This is not something that we're going to do overnight. And this is a very resilient region, and we do need to continue. We do need to continue promoting the balance until, as the director just said, we can have the vaccines for our populations, educational programs, and also to maintain the measures, to involve the community leaders, the celebrities in the various countries, so that constant information leads us to think better whether we are going to have extended vacations with our work colleagues in large groups, We can do it, but always by maintaining these measures. And if we can postpone the vacation, that would also be a possibility, but we need to make sure that we maintain the non-pharmaceutical measures to avoid a second surge. We are not going to reach 0 cases. We will continue to have cases, and if we can avoid for an increase of these cases, we are doing what we have to do. Thank you very much. Thank you, Dr. Espinal. The next question is by Martin D'Ambrosio from La Nación, Argentina. On Monday, Russia announced that in December we would have the first shipment of vaccine sent to Latin America. Do you have any other piece of information on this? Because beyond this announcement, this was not approved by the various entities in the countries. Dr. Barbosa, thank you very much. We have several issues around the vaccines. The director presented a summary of the current situation. The process to guarantee the efficacy and the safety of the vaccine involves at least 4 steps, and that is regardless of the country that is producing the vaccine. First, the producer has to be a good quality producer, that is to say, a producer that has a good practices certificate in terms of manufacturing, and also the manufacturer has to carry out all of the pre-tests, the clinical tests that have already been standardized throughout the world. They do need to publish this data on the platforms so that the scientific community can review the data in terms of efficacy and safety. The third step is a careful review by the regulatory authorities in the various countries that will be using the vaccines. The decision to use the vaccine is a country's decision, and we strongly recommend and suggest that the countries strengthen their regulatory capacity, so that is important. And the final step is the post-marketing surveillance, and this is important for all of the vaccines, and for new vaccines, for any disease, are even more important. So, from the point of view, from our own point of view of the Pan American Health Organization, the revolving fund that is more than 40 years old in the acquisition of vaccines for Latin America and the Caribbean, we only require or use vaccines from producers that were able to comply with all of the requirements, and also are vaccines that are recommended by the World Health Organization. So in addition to the revision by a specific national authority, they also have an additional revision by WHO, and this is for greater safety. All of the vaccines in phase 3 are being monitored, and we also have expectations about all of the information that we see on the electronic platforms. We're talking about large recruitments, 35,000, 40,000 individuals that need to be tested, that need to be vaccinated for phase 3, and that's how they provide the data after the third phase, and they obtain the registration of the vaccine. The vaccines may be ready. They may have a positive result, let's say for the first half of 2021. It could be in the early in the first half or later during the first half. This is what we can see based on all of the electronic platforms and all of the clinical trials that have been recorded. Thank you very much, Dr. Barbosa. The next question is by Michael Clark from Canada. The question is,
how long does a person stay contagious after exhibiting any type of symptoms? And also if there is a special treatment to COVID that President Donald Trump received. Dr. Aldiguieri, ¿podría contestar esta pregunta?
Thank you. Thanks a lot for this question. The clinical evolution of the disease can be really very different from a patient to another. The WHO guidance for the isolation of cases are as difference between symptomatic and asymptomatic patients. For symptomatic patients, the duration of the isolation is 10 days after symptom onset, plus at least 3 additional days without symptoms. And for asymptomatic patients, cases, it's 10 days of isolation after positive test. The decision regarding the protocol of treatment to be used is the responsibility of the clinical team, of course, in discussion when possible with the patient. The WHO PAHO clinical management guidelines are being updated according to new evidence, to new science emerging through very strict protocols of research. And the use of dexamethasone has been including in the PAHO WHO protocols a couple of months ago now. Thank you.
Muchas gracias, doctor Aldillieri. La siguiente pregunta es de Mariana.
Thank you very much, Dr. Aldillieri. We will have the next question from Venezuela, from Ms. Garcia, who wants to know what is the progress of antigen testing in Venezuela. We had heard it would be the first days in October, and have there been conversations with the national government? So how many tests of the antigen were sent to Venezuela, and what communication has there been with the government so that they can benefit when the vaccine is finally out? Dr. Ugarte, thank you. Sebastian, thank you. Mariana. Yes, the first lot of 340,000 tests, antigen tests, and they have already arrived in Venezuela. They're in country. Before their arrival, a distribution plan was prepared of the tests and the readers that were sent to, and lab staff was trained. These tests will benefit the 24 states in the country, and delivery of those tests and the equipment will be starting today. And it will continue to October 28th and maybe before, until 27 hospitals have been completed out of the 24 states. Some reading equipment, due to operational reasons and also strategic reasons, will be in reserve to strengthen the areas where they will be needed. There will be a need to increase the tests and also to provide support to those hospitals and institutions that will receive the tests and the readers in case that there be some difficulty or challenge with the distribution of tests and equipment. This distribution has been coordinated and discussed with the Health Ministry and with the National Assembly in compliance with the agreement signed. And work is being completed in the protocol of how to use the new tests. Regarding the vaccine, I would like to mention this, something that is a public knowledge, that the government has requested and has committed to be part of the COVAX mechanism or COVAX facility. In that sense, both the Health Ministry and PAHO have been contacting Gavi Initiative and WHO, who are managing the COVAX facility, in order to facilitate and make flexible the advance payment that the country needs to do for them to receive the vaccines. And this is about $18 million for Venezuela. And under conditions that we all know or are aware of, this is not a facility they can use at this point in time. Thank you. Thank you very much, Doctor. Let us remind the journalists that they can use the Q&A function here on Zoom, and please, you can write on the Q&A in order to coordinate. The next question is from Melina Ochoa, Cuno TV, and Isabela Gonzalez from the La Reforma newspaper from Mexico. They want to know, what do the PAHO think of the resurgence of an outbreak in 8 areas? Is this truly a resurgence of an outbreak or a re-outbreak or not? Dr. Barbosa. In Mexico, as well as in other countries, we need to take a look at what is going on at national level, but also at subnational level, because when we see countries like Canada, the United States, Mexico, Brazil, Argentina, we can see a mosaic of different situations in different province or state or municipality, etc. So in Mexico, after several weeks where we have seen a decrease in Mexico, we have seen that that drop has stopped, because in other areas there has been a report of increase of transmission. So the health secretariat in Mexico is working with the governments of those 8 regional governments to see how to reduce morbidity and to verify what they do more effectively to reduce transmission. And this is also significant evidence to draw your attention to the fact that in states, provinces, regional areas of each country where you have achieved a reduction of transmission, it doesn't mean that the disease is under control. No, because if people begin to have the same intensity of contact, if they decrease the use of masks, if they stop with their social distancing measurements, it is possible that there can be an increase in transmission again. Thank you. Thank you very much. The next question is from Jamaica about the antigen test from Nadine Wilson Harris from Jamaica Gleaner.
The rapid antigen test being made available in Jamaica?
Oh, thank you for this question. Inclusion of antigen-based rapid detection test has been the focus of the last press conference by the director of PAHO. All countries of the America can procure antigen-based rapid test through the Pan American Health Organization Strategic Fund. All countries. This is one point. The second point is that PAHO, at the same moment, is building an emergency response stock, and 1.5 million rapid test antigen-based will be deployed to countries with needs when their surveillance system is challenged by outbreak and there is a backlog of tests and testing at the moment. So this is the situation. But the most important, and I would like to repeat, all countries can procure antigen-based rapid tests through the PAHO Strategic Fund. Thank you.
Gracias, doctor. Siguiente pregunta viene de Felipe Santana.
Thank you, doctor. From Felipe Santana.
Would not buy the CoronaVac vaccine. Is there a reason not to trust that specific vaccine? New cases in Brazil dropped to a level we have not seen since May. Is that a reason to relax the measures? And also, he said, studies point to a drop in death rates. Is that a reason to celebrate? Dr. Espinal?
Thank you very much, Felipe, for that important question, which is 3 questions, basically. Let's try to address them. PAHO will not get into political issues in discussions internal of countries. I mean, Brazil has committed to different type of vaccines. But what we recommend basically to countries is to go through the revolving fund for vaccines of PAHO and through COVAX to ensure they get access to the best vaccine after they are approved and endorsed by regulatory authorities and international agencies. No vaccine is yet authorized to be used. All the vaccines that are in test now are in clinical trials, experimentation, which is called phase 2, phase 3. But before approving a vaccine, we need to see the data, the final data. So we don't recommend actually that countries should purchase directly vaccines from any supplier, because we think COVAX is the way to go, and through the revolving fund of PAHO, who has been supporting countries for decades now. Remember, Latin America and the Caribbean is probably the region that has more experience than any other region in terms of immunization and using vaccines. That's one thing. The second issue is that there is no cause for celebration in drop of death rates. We of course congratulate countries when they drop these cases, but there is a tricky issue there by letting down our guards, because we don't have a vaccine yet, as the director was saying. So we need to make sure we keep that balance with the implementation of the non-pharmaceutical measures, so the population continue applying these measures and the educational programs I mentioned, to avoid a second wave or a second peak, and we still might not have been left out the first wave in Latin America. So because we see dropping rates due to the good efforts of the countries, we can congratulate ourselves a little bit, but we need to continue with the measures, because this virus is unpredictable, and we have seen in Europe and in other regions new peaks, and actually in some countries in North America also new peaks. So I think it's important that not to relax the measures. So we recommend to be good and congratulate ourselves a little bit on the measures, but we need to continue with the measures and the actions to prevent more death until we have the vaccine available. Over. Thank you.
Gracias, doctor. Y con respecto a vacunas, tenemos...
Regarding vaccines, and thank you, doctor, we have two more questions. One from Kevin Alvarado from Trinidad and Tobago, and from Alejandro Marcos from Trinidad Lumia. And is Trinidad and Tobago among the 11 Caribbean countries that joined the assistance plans to purchasing the vaccine? And Alejandro Marcos from Lumia says, what measures of additional preparations and recommendations do exist in order to reinforce safety or security in preventing the possible counterfeit and theft of vaccines that may be available? So how could we take those preventive measures? Dr. Barbosa. Yes, thank you very much for the questions. PAHO is working with many institutions, financial institutions such as the Inter-American Development Bank, the European Union, the World Bank, and others, in order to look for alternatives that can facilitate the access of countries in the region to vaccines by means of the COVAX facility. Some countries in our region were impacted by the pandemic, countries in the Caribbean whose economy is based on tourism, and they have had practically a year without any tourist activities. So as our director said, we have had a good negotiation with the CARFA and with the European Union, and this has made it possible to support Caribbean countries, those 11 countries. Trinidad and Tobago is one of the 11 countries, and we are still reviewing all the details and see how they will better use this grant from the European Union to enhance the availability or the possibility of Caribbean countries to access vaccines through COVAX. For the second question, I think that the great responsibility that we will all have is to strengthen the regulatory capacity of each country. Countries that do not have a strong regulatory capacity have a larger number of claims of substandard or counterfeit medicines and vaccines and others. And so this is important to strengthen the regulatory authorities. And for the Caribbean, we are supporting the strengthening of the regulatory capacity at sub-regional level so that Caribbean countries can share in this because they have a smaller market in terms of volume so that they can deal with regulatory matters together. Also, Central American countries are also organizing themselves in this way. This will be a challenge because unfortunately people may try and use illegal means for counterfeit. And so we need to be alert and with the participation of citizens so that they can denounce with the police and with other authorities to see if people are selling counterfeit vaccines or medications that are not recommended, and so this can be a follow through with citizen help as well. Thank you very much. Thank you, Doctor. The next few questions are related to traveling from Hector Rendon from Factor RH. He wants to know regarding whether it is recommended to have measures such as curfew or closing borders through aviation, cancel flights, etc., given the resurgence of the outbreak. So does PAHO think that this is a possible way to go given possible infections? Yes, thank you, Sebastian, Hector, and Paulina. The actions of limiting movement of people, as in the case of curfew, or limiting domestic travel within a country or international travel, these are extraordinary measures that are taken when there is massive, very active transmission of cases and when it is not possible to detect those cases in time. And so other control measures for the pandemic cannot be taken. However, if those measures are taken in isolation without the other measures, then what we are doing really is delaying in many situations by days or weeks a transmission that is impossible to stop. We need to remember that the risk of transmission of COVID-19 through movement of people or domestic travel or even international travel cannot be eliminated. So it is necessary to take into account that if the country decides to activate the economy or tourism by having international travel, they need to be aware of the risk, but they need to also take other measures. And those measures that have been recommended from the beginning, from the outset of the pandemic, which have been valid, continue to be so. First is detection of cases. We need to find those people who have the virus of COVID-19, and these may be symptomatic patients. If they're not symptomatic, then we need to take samples to do the tests, identify those with the virus, isolate them, and give them appropriate treatment, identify their contacts, do contact tracing, place them in quarantine while the tests are going on, and the other measures, which are physical distancing, use of masks, masks and hand washing. With these measures, it has been possible to control transmission of the pandemic, and it is necessary to say that these measures, when applied appropriately throughout a national territory within a country, including tourist regions, are important in managing COVID-19 pandemic. I would also like to add that it is not justifiable to quarantine international travelers in the sense that yes, there may be contacts of COVID-19, but countries that are demanding testing of negative diagnosis of COVID-19 before the travel starts, they need to take into account that that result is only applied to when the sample was taken. In some cases, several days elapse before the travel takes place. So it's a false sense of security. And just to reinforce that the measures to case detection and all the other things that I have mentioned before here need to be implemented at all times. Thank you very much. Well, thank you very much, Doctor. We have a question live, and I would like to give the floor to Gabriela Sotomayor from Procesos Mexico. Gabriela, if you can hear us, you have the floor. Yes, thank you very much for taking my question. Hello, and nice to see you all. My question has to do with the rapid antigen tests, and especially those that were sent by you to Mexico. You sent, as far as I understand, 200,000 tests, and the health secretariat in Mexico said that they were going to assess them. My question is, why do they need to be assessed or evaluated? And also, can these rapid tests be a good option for the region because they are more economical, because they are quick tests? And in our countries, it's very hard to do the lab testing, especially in places like Mexico. Thank you. That was my question. Thank you, Gabriela. Yes, Dr. Alighieri, could you please answer? And then Dr. Barbosa may want to complement the answer. Yes, thank you very much for your question, Ms. Sotomayor. It is a normal process. All countries have their own regulatory authorities with their terms of reference to evaluate and assess new products and new technologies that arrive in a country. But there's also the idea of organization of surveillance network. And in Mexico, the national head is INDRE, the National Institute of Diagnostics and Reference. And there are several issues I want to bring up. That evaluation, that assessment includes a new methodology, and how a new methodology enters into a situation vis-a-vis the gold standards such as the PCR. In remote areas and indigenous areas, and then we need to focus on the primary health care. So this is not something that happens overnight. When you're talking about expanding capacity within an existing network, which in Mexico has been strengthened in molecular biology and PCR, back from the influenza pandemic back in 2009. The second part of your question, yes, it is a great option for the whole region, and we are talking about North America, Central America, the Caribbean, and South America. It is the word in English, and I'm not sure, but it's a game changer. It's something that radically changes the situation, and it allows for several interventions to be strengthened in the fight against COVID-19. And I now give you the floor, Dr. Barbosa. Yes, to complement that, this has been a very important initiative to broaden the testing capacity in Latin American countries, Mexico and other countries, as has been mentioned. this new test is available for those countries who want to buy it through the strategic fund. And in those situations, as mentioned by Dr. Alighieri, where rural areas and indigenous towns and in the periphery of large cities where having access to a PCR test is harder, now we have this new alternative which has excellent quality and can guarantee more capacity in the countries to do testing. It is important not only to know exactly what is going on, if there's a trend to growth or to decrease, etc., but it is also important for individual measures for quarantine, for identifying and doing contact tracing and isolation. So this is an initiative with the Mexican government to broaden their capacity for testing. Thank you. Thank you both. The next question from Ariel Alberto Jara Acosta on the chat. It's something mentioned by Dr. Espinal about protection measures. So what would be the best and most timely mechanisms of protection to be taken into consideration while you're out on vacation? Dr. Espinal. Yes, thank you very much. Well, there are measures that we need to take into account. For example, the use of masks, avoiding airplanes. They should only be used for essential travel and mainly longer trips because you will be in a confined area. You can travel, but taking precautions. But if we can travel domestically, well, so much the better. Because we can drive to the beach or to the countryside or the mountains. So hand washing, social distancing, masks, avoiding closed areas, closed restaurants, the creases when you are out there dining al fresco in a courtyard, etc. There are measures that need to be taken into account very seriously and avoid crowds. If you go to the beach, well, look for a place that is more isolated, not crowded, and also take into account that there is a risk always if we go to places that are crowded. Also, you should take into account whether it is necessary to go on vacation. And if you must go on vacation, you need to take those measures into consideration. Thank you very much, Doctor. The next question is by Etienne from AFP. Dr. Etienne has mentioned that there is a spread of COVID throughout the region. Have deaths increased in the Americas? And what is the evolution of the number of deaths in Latin America? Dr. Alighieri. Thank you very much for your question, Ms. Dieste. Yes, unfortunately, we continue to see every day 100,000 new cases. We have also seen an increase in deaths. And yesterday, over 1,730 deaths were reported at regional level from all sub-regions. Yesterday, 610,475 deaths was the accumulated number in the region. And yesterday, 5 countries had reported over 100 dead. United States, Argentina, Brazil, Mexico, and Colombia. So every outbreak brings with it a burden of death, and every day we continue to receive reports of deaths every week in the region. Okay, thank you very much, Doctor. We are coming to the end of this media briefing. One of the last questions from Valeria from Argentina is, in your opinion, do you think it's relevant to compare the amount of cases and deaths among countries, specifically regarding the number of deaths per million inhabitants? And are there objective measures for those comparisons, taking into account that not all countries have the same kind of registry and ways of recording? Yes, Dr. Espinal. Sebastian, I am so sorry. Could you repeat, because I lost the sound? Is it appropriate to compare the amount of cases and deaths among countries, specifically regarding the amount of dead per million inhabitants? And is this appropriate comparison, given that countries record differently? The amount of death per population is an internationally accepted indicator. However, we should not compare, because each country has their own dynamic and their own characteristics. So it's not the same thing to compare a large federal country, Argentina, Mexico, Brazil, or a smaller country, Dominican Republic, Honduras, etc. So you can take this as a way in which, or a way of how things are happening in each country, but you should not use this to compare, to say inherently that our countries are doing some things better than others. These are indicators that are accepted, and they allow us to take more urgent or less urgent measures. And we should also see it not only nationwide, but also locally too. For example, by municipality, by state, because in that way we can detect incipient outbreaks. It gives us a general overview of what's going on in each country, but we should not use it, I repeat, to comparisons here and there. But what we should is always promote best practices, because we all have best practices in our countries. But yes, these measures are used by per 100,000 inhabitants or 1 million, etc. The last question.
You mentioned the importance of safe and efficacious vaccines, but what exactly is PAHO doing to support countries in ensuring this? Dr. Etienne?
Thank you for this question. PAHO has been providing technical cooperation and resources to complement the efforts made by countries to address and mitigate the impact of the COVID-19 pandemic for many months now. We have developed 105 evidence-based documents. We've delivered 169 virtual and in-person training sessions. And we have also sent more than 17 million PCR tests and over 146 tons of PPE. You've heard we've also been sending to countries the rapid antigen test. We've also supported 91% of our member states in the development and implementation of their COVID-19 response plans. Most recently, these efforts have focused on ensuring that our region has equitable access to a safe and effective COVID-19 vaccine, and that in the meantime, countries have the systems in place to prepare for, to distribute, and to pay for this vaccine once it arrives, so that populations are protected as quickly and effectively as possible. To ensure equitable access to a vaccine for our region, PAHO is engaged in the COVAX facility, as you heard before, which is an unprecedented initiative to ensure that participating countries are guaranteed vaccines for up to 20% of their population in the first phase. That is enough to protect health workers, frontline workers, and those at the highest risk for severe COVID-19. Not only is this a vital part of reducing the impact of the virus on health systems, But because we know that with COVID-19, no one is safe until everyone is safe, protecting our most vulnerable populations is key to getting back to normal as quickly and as safely as possible. PAHO's revolving fund, as you've heard, will be the purchasing mechanism for the COVAX facility in the Americas, and UNICEF will purchase the vaccines for COVAX members outside of our region. While 10 lower-income economies in the Americas will receive financial support through COVAX, PAHO is also working with various financial institutions and organizations to support the self-financing countries in our region to access the necessary funding to purchase the vaccines through the COVAX facility. We are continuing the work with national regulatory authorities to ensure readiness, and you've heard several times mention made of the importance, the role that national regulatory authorities must play. But beyond access, PAHO is also working with countries to undertake national preparation assessments to be best prepared to distribute the vaccine to those that need it the most as soon as one becomes available. This encompasses a comprehensive technical cooperation package covering regulatory aspects, planning and forecasting, training health professionals, communication, cold chain strengthening, and post-marketing surveillance. PAHO is also working with Gavi on an initiative to support national and subnational cold chain improvements in some countries. PAHO, this is our role and our mission, and we will support our member states to ensure that together we can, as I said, overcome COVID-19 in our region. Thank you.
Muchas gracias, doctora Etienne. Ahora sí hemos llegado al final de esta sesión. Gracias a todos.
Thank you very much, Dr. Etienne. Thank you all for participating. And in briefly, we will be sending you the comments by Dr. Etienne and also recording of this session. And you can continue in contact with us through email and find further information on the PAHO website. This Friday, we have a webinar for journalists and communicators on responsible coverage of COVID-19 vaccines. It will be in English this Friday, and it will be in Spanish the following Friday. So save the date and you will receive more information from us. Thank you for participating and have a nice day.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.